Alrighty, so we have Porter here, and he is going to be our star of the show today. He's not very excited right now, but he will be when his teeth are all nice and clean. So we just wanted to make this video to show everybody what exactly goes into a dental procedure today. A lot of people wonder exactly how it works and don't realize that it is very similar to what we do at the dentist as well. So this is to start. So just like any anesthetic procedure, we keep them on IV fluids just to keep them nice and hydrated. And right now, Porter is getting pre-oxygenated, so he has his oxygen levels good as he goes under anesthesia. So right now, Jenna is administering propofol. This is to induce the anesthesia before we put him on the gas and intubate him. So while Jenna is inducing Porter, I'm just going to show you some of the equipment that a lot of you might be familiar with. This is our dental x-ray machine that we do for most of our patients. This is to show us things that are going on that we can't see just by looking at the teeth. It's a very important process, and you'll see that later. This is our dental machine that does the scaling, it does the polishing, also it does the drilling. So same thing as a dental machine you would find at the dentist. As you can see, Porter is definitely in need of a dental cleaning. A lot of people don't realize how bad these back teeth can get because we don't really look into our dog's mouth that often, which is really important to have us check the teeth about once a year to make sure everything's good. Okay, so as you can see here, Jenna is scaling the teeth, and although Porter doesn't have much tartar on his teeth, the reason that he is here today is this tooth right here. It's known as the carnassial tooth. It is a 3-rooted tooth that is the largest in the mouth. So a lot of times with these bigger dogs, what happens is that they chew on really hard things and they actually get something called a slab fracture. And we'll show you on the other side what the tooth is supposed to look like, but he has a big chunk missing. And a lot of times these dogs will act like nothing is going on. They won't show you any signs of discomfort, but it can cause a lot of issues in the long run. Okay, so Jenna is now about to take her first dental x-ray on Porter. This is also very similar to how we get it done at the human dentist. So what you can see here, we have to line it up. There is a little plate inside of his mouth, and we are going to take the first x-ray. Let me step back. So here we are after completing the surgical extraction of the tooth that was shown earlier with the slab fracture. As you can see, there's several sutures in here to assure that it heals properly. Now we're going to proceed with polishing. The purpose of this is to fill in any gaps that were left from the scaling that was taking all of the tartar off the teeth. This will help prevent in the future excessive tartar building up again. So the last part of the dental procedure is we're going to be applying an Oravet gel, and what this does is seal the tooth so it helps prevent tartar for at least the next 2 weeks.